Want to learn more about substance use? Maybe it's something you're silently experiencing, or you have a loved one who needs help. Check out Cycabs Mental Health Ally Certification. We have a 1-hour course dedicated to substance use awareness that covers overdose warning signs and withdrawal, and resources to get help. It's only $15. Or you can complete the entire Mental Health Ally certification for just $99. Visit psychhub.com/learning to get started. Hi, I'm Marjorie Morrison.
And this is Patrick Kennedy.
And you are listening to the Psych Hub Podcast, The Future of Mental Health. Welcome to another episode of The Future of Mental Health. I want you to sit back and remember what it was like when you were a kid, what you felt like when you were anxious or stressed. Did you tell your parents? Did they take you to therapy? Imagine what kids these days are going through with anything and everything at their fingertips. How do they navigate it all? How do they know what's trustworthy? In today's episode, Patrick and I interview Solome Tibebu, a mental health entrepreneur and the founder of the Upswing Fund, the first philanthropic fund dedicated exclusively to mental health. It's backed by Melinda Gates. She exposed us to so many different complexities of teens trying to navigate the mental health system I'd never thought through before, like how you're supposed to have therapy when your parents are quarantined in the same house in the room next door, or what they look for in a therapist, which may be so different than an adult. Solome is going to share emerging digital tools and solutions on the horizon to make the paradigm shift needed for the future of mental health. Enjoy the show.
Wow. Thanks so much, Marjorie. Really appreciate the introduction. So things started early for me. I had really bad anxiety and OCD as a teenager. I had no idea what was going on with me. My family had no idea what was going on with me, but regular panic attacks about somebody in the family dying, obsessive thoughts and compulsive behaviors on just totally bizarre things that really troubled me and my family a lot. And, like you mentioned earlier, my parents, they didn't even have a vocabulary for a phrase like obsessive compulsive disorder. And so I'd say it took a bit of time to eventually get the help that I needed, but ultimately was fortunate enough to be able to see a clinician and address the OCD. It took a few tries, but I would say the therapists that helped the most really empowered me with psychoeducation and knowledge about what it is that I was dealing with. And so around that time, I was like, gee, why can't all teens be able to have access to this kind of information and connection with others? Because I really felt so alone in what I was going through. In fact, I remember shopping for a therapist, just scrolling through Psychology Today. I was looking for the oldest clinician I could find, just in case there was a chance that in all of their experience, they would have been able to see something as unique as me. And I think a lot of people can relate to that. Of course, what I was experiencing is quite common, but I didn't know that at the time. So all that to say, I eventually decided to start said resource for other teens. It was a blog called Anxiety in Teens, very creatively named, where we could connect with one another, share our stories through writing. And for the next 10 years, I had cohorts every season of students, high school and college students nationwide, writing for the site and doing virtual peer support. And we also did some other events. So I'd say that's really what got me interested in the space. By the time I got to college, I knew I wanted to pursue entrepreneurship and innovation in behavioral health. It was clear to me that access to behavioral health is the huge challenge. I still to this day believe that we don't have the amount of professionals we need to be able to meet the demand. And so what are some creative, novel, yet effective ways to be able to scale access to mental health, specifically through technology? And that's really what has led me down the career that I'm in.
What amazes me listening to that was just an incredible little bridge that you gave us. How does someone take what you went through, anxiety, feeling anxious, feeling different, feeling like nobody could relate to this, feeling that you were unique, to turning that into this true advocacy piece, to opening up a platform for other people to come and share their thoughts and opinions? Like, how does that happen?
I mean, it was really like I needed this for me. I wished that there was an online resource where I could connect with other youth. And later on, when I started a mental health tech startup, it was because I wanted to access my mental health homework digitally, even as late as the conference I hosted earlier this year. It was apparent that all of the other healthcare conferences were getting canceled. There wasn't really a specific place for behavioral health stakeholders to convene. Not really sure how that made the connection to I should be the one to do it, but who else is going to?
It's very impressive. So what would you say you've learned the most so far that was a surprise to you or shocking?
In terms of just the overall journey, whether it was starting my own mental health tech startup in college or working for other behavioral health software companies, later working at a couple different healthcare venture funds, investing in digital health broadly. I don't really think I understood how convoluted payment is in digital health and behavioral health. And still to this day, a lot of early stage mental health and substance use startups are grappling with what is our business model? How do we get reimbursed? I think that's a major area of frustration for a lot of early stage startups, and it certainly was for me. Secondly, is this idea of there hasn't been a whole lot of measurement happening in behavioral health, and it just kind of opened my eyes. Recently, I'm seeing a lot more measurement-based care focused behavioral health startups, which I think is really exciting. But when I first heard that, I was like, this hasn't been happening. And it was because, it's hard to do. So, but at the same time, so I'm very excited about it.
Solome, the Kennedy Forum, when we got it started, one of the first papers we put out was the importance of measurement-based care. It's interesting. We often don't get paid for these services because payers are suspicious of what they're paying for and is it worthy of reimbursement. And of course, we're like, we got to get some money in here to begin with in order to get this whole system rolling. And then we can start to perfect it over time. It never held us back when it came to treating all other areas of medicine. We plowed ahead with trillions of dollars for cancer for 30 years before we even got any kind of breakthrough in terms of therapies. Now, of course, the acceleration in oncology is just making cancer more of a chronic illness than a fatal illness. It's just so exciting. But I think that this is, we have a double standard, obviously, Solome, in mental health, and it's part of the overall personal fear and shame and stigma that exists that we all face as patients. The system is facing kind of in our society. But you have been terrific in just being out and around. And as you said, you kind of were thinking, well, this is what I would like to have. And it wasn't there, so you filled in. And I think that's a great message for a lot of people who are listening to this podcast, because we're really kind of still at the ground floor of this. We're the beginning of, I think, a real new frontier. And there is all kinds of room for people who are listening right now to help us fill in this space and get out there and take the kind of initiative that you've demonstrated in your own life, where you took something that seems so overwhelming. Anxiety it can be so paralyzing, and yet it's, the most common form of mental illness. And then to blast through that and to do it by helping other people, which of course, as you know, in recovery in general, is the way we recover, is by focusing on helping others so that we're not feeling so isolated and unique, as you put it at the beginning. So can you talk a little bit about that idea of peer kind of support, how you maintain your recovery through interaction with others and help of others?
It's really important to me, actually. As I take on a lot, there's always a lot on my plate, more than there probably needs to be at any given time. It can be overwhelming, but just the ability to connect with other entrepreneurs, other mental health advocates, to be able to regularly connect, especially through the pandemic, not having our regular forums to connect face to face. It is really important, and it makes a huge difference for me personally. And, at times I've been overwhelmed and thought, oh, well, I've been doing this for so long now, I should be able to manage it myself. And, but I think that's a trap that one can easily fall into. It wasn't until maybe a decade after my really hard time throughout middle school of overwhelming OCD and anxiety that it came back later on. And I was kind of surprised by it. Like, what? Here I am giving TED Talks and doing all this work in mental health, and why am I so overwhelmed with anxiety again? And then I think that's when it really clicked for me that, no, this is something I'm going to be managing ongoing for who knows how long. And so it is important to continue those types of self-care routines, and definitely connecting with other like-minded peers is a powerful way to do that. And so that's why I'm really excited about a number of startups that are focusing on peer support to just leverage this amazing workforce that we have and mobilize them to help one another, sometimes more effectively and with less stigma potentially, to get other individuals into care than traditional mental health.
You know that airplane metaphor of putting on your oxygen mask first before you help someone else? Mental health is no different. In order to take care of others, you have to help yourself first. But what does that look like? Take Psych Hub's Mental Health Ally certification for starters. It's 8 one-hour courses covering anything and everything, from substance use to diversity in mental health, how to help others, suicide prevention, and more. Plus, it's self-paced, so you can take it at your own schedule. Become a certified, trusted resource to come to for mental health concerns. Visit psychhub.com/learning to get started. Tell us about the Upswing Fund. How did that come about?
Yeah, for sure. So one of the most exciting projects that I've been able to announce in the last year was the Upswing Fund for Adolescent Mental Health, which really came to be as a result of the pandemic. As you can imagine, COVID has had such a huge impact on youth mental health, everything from the school shutdowns to the providers struggling financially who were trying to support them. And so as a result, Pivotal Ventures, which is Melinda Gates' personal office, decided to do something about it. And so we rapidly stood up the Upswing Fund, which is one of the first philanthropic funds dedicated exclusively to adolescent mental health. And like you mentioned, we came to be as a result of COVID. So a lot of our initial grant making has been focused on COVID response. But as you can imagine, adolescent mental health, the needs and demands are spanning well beyond that. So we may broaden our scope in subsequent RFPs. But so far, the types of grants that we've already done just in the last couple months have focused on, first, our surge capacity grants, which are grants to direct service providers who are especially reaching LGBTQ adolescents and adolescents of color. And so these could be traditional mental health clinics, or they could be community-based organizations that are really doing a good job of engaging this population. And the next track or RFP that we announced is around systems enablers. These are mental health nonprofits that are truly transforming the adolescent mental health ecosystem, whether that be through stigma reduction, policy work, workforce development, digital technology, or integration. And then finally, we also funded a couple national networks of culturally competent clinicians who could serve LGBTQ youth and youth of colors really well.
How did you choose that?
This was a super quick process, like pretty much from August. We had the idea, like back of a napkin, that we wanted to do it. So everything from building a team to defining the criteria, figuring out what we're going to fund when, what should be in scope and what will be later down the road, to announcing the RFP, to collecting over 5 times the amount of applications that we were expecting to receive, and reading a lot of applications over the holidays. So, it's been quite the experience.
Wow. And have you found, was it hard to get the word out?
I mean, my fear is always, no one's going to show up to my event, or no one's going to apply. But no, we had a couple proactively reached out to some press, but for the most part, a lot of it ended up being inbound. People were super interested, had a lot of opportunity to share the message. And then again, we're overwhelmed with the amount of applicants, which just goes to show the huge need for resources for this population.
Yeah, I mean, we think about this and talk about this so often, adolescents and LGBTQ and color. And so you're spot on. How do you, if we have listeners who are, starting a grassroots, as Patrick would say, now is an opportunity for people to, start being advocates wherever they are. What kind of criteria do you use when you think about funding something?
In terms of, for the Upswing Fund in particular, first and foremost, we were really concerned with organizations who could do a good job of actually engaging the population we're looking to reach, LGBTQ adolescents and adolescents of color, ages 10 to 18 years old. Because, it's one thing for a clinic to say, oh, we're going to hire a clinician and, if we build it, they will come, versus a small CBO that's been doing really amazing work, maybe an emerging organization that just hasn't had their chance to have somebody really believe in them and help them get to the next step and scale this amazing work that they're doing, because they really understand their community, they're embedded in their community, and that's what I'm super excited about. And so once that's addressed, then all of the typical things like what's your plan to sustainability, and how do you partner with other organizations to carry out your mission, that kind of thing.
Amazing. It's truly amazing what you're doing. I mean, I think it's going to make such a difference in so many ways. And I love just seeing how you've taken all of these different areas and kind of brought it together. So now tell us about the summit that you ran.
My hope is that gaining access to mental health, mental and emotional support would not take 6 months. Hopefully it won't even take 6 minutes. So we need a huge paradigm shift for that to happen. I also wish that there would be just tons of personalized options to meet the specific needs of all individuals to be able to get the right care for them. My concern around a lot of the new innovative behavioral health tools are they're not developed for all populations. I wish that families would be more empowered to know how to support their loved ones, what to do. I mean, thinking back to my parents who, just immigrated this country. They were overwhelmed with so many things. The last thing they needed was a child with special needs that they had no idea what was going on with, and they literally had no one to turn to figure out what to do. That's definitely the types of situation I want to prevent. And then more reduced stigma overall. I mean, we can have the most amazing digital tools or other novel solutions being disseminated through the workplace or healthcare, but if there's still too much stigma, then the adoption won't be there. So those are the kinds of things I'm really hoping we can transform for the future.
Solome, can you talk about that family experience? Because I think you're really right on. I think it's a family issue. When one person suffering, the whole family suffering, and people often adapt in ways that aren't helpful to resolving the situation because they're more reactive than proactive. They don't have the skill set. Of course, there's no toolkit or how-to guide. So what are you seeing out there that's helping to fill this space? Obviously, at Psych Hub, we're very excited to begin to produce some micro videos that are short in duration, culturally competent, focus on the family as well, because they've been family interventions, like you just point out, have so been left out of the equation. That's why I'm so excited when you said that. It's really where so much of this lies, is helping to facilitate that family engagement. If you feel comfortable talking a little bit about how things have been with your family in that conversation, so to speak, from the beginning till today.
They, at least in my particular situation, I do kind of, to some extent, I felt like my parents were just paralyzed with what to do for quite a while. We tried different therapists and different medications, and it wasn't until the fourth therapist that I really found somebody who understood OCD and was doing ERP and really gave me the right treatment that I needed. And so it just goes to show that if we would have given up at number 2 or number 3, I remember sitting down with my parents and thinking, oh, this medication doesn't work either, but maybe this is as good as it gets. But we didn't have anyone telling us, okay, no, you can keep trying. These things are manageable. You just have to find the right combination for you. And so thankfully, they were willing to continue down that road, and I finally found the right combination for me. So that's an important thing that I would like anyone who's listening to know. But since then, I think a lot on the bright side, there have been more solutions that have come out for families and parents. I really feel like in the last year especially, payers have been asking me about, are there any youth mental health startups that are doing a really good job? Employees are demanding it of our employers to be able to have some mental health resources for dependents, as we're all trapped at home struggling together as families. And so really interesting to see some of the emerging youth behavioral health startups growing and announcing and getting more funding. And I hope that could help alleviate some of this issue.
What are some of your favorite resources?
Definitely the Trevor Project continues to be an amazing resource for LGBTQ youth. We'll have even more that I can announce once we announce the Upswing Fund grantees. I think a lot of them have struggled a lot throughout the pandemic. When it comes to like video therapy, for example, a teen who's stuck at home and isn't out yet, well, they don't want to use video therapy if they know that their parents can hear them in the next room. And so a text-based crisis support solution might be better. The Acoma Project, Dr. Alfie Braylon Noble, who's also an advisor at the Upswing Fund, has been doing this work specifically around adolescent mental health for youth of color for decades now, and she's got resources for all stakeholders. Made of Millions is another resource that has tons of psychoeducation resources online for consumers. There's depending on the population, I'm really happy to see that there's been a proliferation of tools, but obviously everyone should check out Psych Hub because tons of resources in the workplace and beyond.
I have so much admiration for you and people like you that use their voice. I think Patrick does it every day too. It takes so much confidence and so much courage to be able to share, your own experiences publicly. And then, when you do, it makes it okay for other people to share. So, I'm incredibly grateful for you and your voice and your advocacy for people. And I know when we think about the future, this is this population that we're the most concerned about, and the adolescents. And it's tough. I have one myself and he's 18 now. So I guess he's not technically an adolescent, but he is. And I see how they're so isolated, with COVID and taking classes online and by themselves. And that's not healthy, right? So I am so grateful also that you're, investing in all things in that area. In time and energy and resources and all of that. So I thank you. If you had a magic wand and you could have a perfect future of mental health, what might that look like for you?
Well, it would be definitely a lot of things I mentioned earlier. The ability for what would it take for more access to mental health support for more people? That's it. That's, I believe, practically speaking, that is going to include effective, proven digital solutions to expand the reach of the professionals we do have. Same thing with peer support. Maybe we start branching out into some interesting models like task sharing. So I'm less concerned about the means, but more interested in how can we get more cost-effective, efficacious mental health for youth and families everywhere.
That's a beautiful answer. And what about you? What do you hope to do down the road?
Yeah, I guess I'm really happy with how the grant making has been going with the Upswing Fund. As you mentioned earlier, the Going Digital Behavioral Health Tech Summit was our inaugural event last year. I was just hoping at least 100 people would show up so I wouldn't embarrass myself on the Brella app. But we had over 2,500 attendees, 75 speakers, 40 sponsors. Of course, having Representative Kennedy as one of our keynotes was a huge draw. So excited to continue that and to be able to further convene the behavioral health tech community to get outside stakeholders engaged in this important work, because we can't just be sitting in silos forever.
Solome, you have an incredible reputation. Whenever your name comes up, people always have such good things to say about you. So that's also a great thing. Well, I can't thank you enough for being on here with us. You're amazing. Where could people reach you?
Yeah, I'm on all of the social medias, Twitter at Solome Tibebu. Happy to share some links. Follow our Rethink Behavioral Health Innovation newsletter at rethinkbhi.com for monthly updates on behavioral health tech industry. The Upswing Fund also has our newsletter for announcement on our upcoming RFPs. And connect with me on LinkedIn, and looking forward to meeting everyone.
Thanks so much, Solome. As a father of a 12-year-old who I can't wait to see all the new initiatives that you embrace, because we're going to need to look at the toolkit in our household. And then she's got 4 younger siblings coming up right after her. And so the timing is perfect. You were there just to be ready for me to be able to keep things rolling in our household. So for no other purpose. Solome, thanks for fighting for the Kennedy household down here in South Jersey. And keep up the great work and invite me on. I'm happy to join anytime. You're doing great work.
Thank you.
Hey everyone, it's your friendly neighborhood Kevin Hines, and here's your brain health tip of the week. Be kind. We all have mental health, so let's be kind and support one another. Research shows that people who consistently help others experience less depression, more calmness, and better health, and they may even live longer. Invest in yourself by becoming a Psych Hub certified mental health ally. You'll be equipped with mental health competencies and become a trusted resource to help support your network. Check out psychhub.com/learning to learn more.
As always, thank you for listening to our podcast.
If you enjoyed the show, drop us a review.
If you haven't already, subscribe to our podcast for the latest episodes.
For the latest insights, check us out at psychhub.com.
Calling all mental health providers. Looking to specialize in treating adolescents? Check out Cycabs cognitive behavioral therapy courses. Receive specialized certifications and hone in on your skills. Get 1-year access to patient videos and worksheets that you can email or text to your clients to keep them engaged in between sessions. Plus, you'll be placed on the Psych Hub registry, where consumers of mental health who are searching for certified providers that are specialized in their condition can find you. To learn more about CBT for adolescent training, visit psychhub.com/learning.